Namaste. I'm Dr. Renukaprasad, Managing Director and Diabetes Consultant for New Diabetes Center and Polyclinic, PB Mohalla, Mysore. Today's topic is the effect of diabetes on heart disease. In today's session, let us discuss about the diabetes and its complication and the effect of this diabetes on heart disease. At present, the heart disease is one of the leading cause for hospitalization or even the death of the people with diabetes. Most of the people, they know the fact, but very few is acting upon to reduce this risk in our day-to-day. Now, why heart disease will happen? That is because of the either reduced blood flow to the heart or even the complete stoppage of the blood circulation to the heart. That is because of the blockage in the heart. Why there will be blockage in the heart rate? That is most common cause. In that case, you can see the high blood sugar. In other terms, we can say diabetes. Now let us see what is diabetes. The diabetes is a vascular metabolic syndrome which make the body inability to control the blood sugar. In other way, the body, there is a higher level of the blood sugar. That is because of there is an absolute deficiency of insulin or inappropriate secretion of insulin or both. Now, let us see what will happen when you take food. When you eat food, the glucose will release to the bloodstream, and with the help of insulin, it will enter into the each and every cells which provide the energy. But whenever there is a lack of insulin, or if there is an insulin resistance, the insulin will not help to break the glucose and provide the energy. And this is the condition where what we call diabetes. Now, so what is the relationship between diabetes and heart? The people with diabetes having the higher risk of getting heart attack even at a younger age. According to the one of the recent study, what we can see, the people above the age of 65 is actually getting more than 68% of the people more than 65 years age are dying due to heart attack. So, is there any way to control this? Let us see. Now, as I said, the blood sugar is one of the reasons to worsen the heart problem. Now, how it will happen? Whenever there is a higher blood sugar, it will worsen the cholesterol level. So it will damage the blood vessels. Not only that, it also make the blood pressure to control very difficult. Now, whenever there is higher blood sugar level due to diabetes, which damages the blood vessels and which also make prone to get atheroma. Atheroma is a condition where narrowing of blood vessels. So because of the narrowing of blood vessels, there is no proper blood flow to the heart, including the heart. Whenever there is a stoppage of blood to the heart, it will cause heart attack. Now, let us see, is there anything to do with this? There are a number of things we can do to minimize this burden. Now, most important thing are very the makeable changes, what we can do, the lifestyle changes. And these lifestyle changes in every diabetes patient is required, but it should be in the very significant way. It should be the long-term commitment. So in that way, we can control the heart problems even in the diabetes. Now let us see what are the changes is required to make this to happen. Now, as I said, this lifestyle changes is like eating a heart healthy food and strict monitoring of blood glucose, quitting the smoking or even alcohol, and engage in the regular physical activity, and of course the stress reduction, reducing the stress factors. With this, we can able to do it. Now let us see how strictly we can control the blood sugar. Under this, we can see the A, B, C of diabetes. What does mean? The A stands for HbA1c. You should know your HbA1c, which reflects your 3 months blood sugar level in a person. It will reflect not only the today's, but also from the last 3 months. It will definitely differ from our day-to-day SMBG, self-monitoring of blood glucose. And you should ask your doctor what would be your ideal number for your control, because it will differ in different conditions and patient to patient. Now coming to the B. B stands for the blood pressure. As we know, the blood pressure is, what does it mean? This is the force exerted by the blood on the vessels of actually the blood vessels. Now, As I said, this is one of the important factors to manage your diabetes and as well as heart problem. And the people with the diabetes should have less than 145/90. Again, it will differ, so please consult your doctor to have your number. Now, C stands for the cholesterol. There are two types of cholesterol. One is the good cholesterol, what we call HDL, and other one is the bad cholesterol, the LDL. Now, let us go. What are the changes we can make to minimize this bad cholesterol in our body? The thing is the saturated fat. This is the one actually which causes more damage to the heart. So that's why we can actually stick on to the unsaturated fat more. So what we can do? Very simple thing. Just switch over to the unsaturated to unsaturated. For example, switch the ghee or whatever thing you do, something like butter, to the vegetable oil. And for example, reduce the red meat and remove the skin from the chicken. And always better to switch over to the healthy snacks like fruits and vegetable instead of these chips, cakes, and all the bakery items. These simple changes can make a better changes in our body. Now, along with that, what we can do. So the next thing is how we can do that. As we know, this bad cholesterol, like the heating the higher fats, like saturated fat, which also in the high in the calorie, so which make you gain more weight. The unsaturated fat, which also provide HDL, that is always good to protect the body. And what other things? The eating habits, like how we have to select the food in our day to day. The most important, you should eat the food which has high in the fiber. That's the high fiber. Always better to avoid the beverages, which is more in sugar coated beverages and processed food and refined things what we use in our day to day, and go with the more of fibers and green vegetables and fruits and all the cereals, legumes. So better the fish, nuts with more of proteins. So whole grain. So these are the things what we can get small changes. Next, cut down your salt. That is one of the most worst thing for the heart and even the blood pressure. It is very much linked with the blood pressure, the high intake of salt. Especially the Indians have higher level of salt, which is linked to the heart problem as well. So cut down the salt intake as well. So with this, I think with these changes we can do. The next thing what we can do is very simple. Eat a balanced meal, eat at the right time, eat slowly, and as well as with a reasonable calorie. These are things what we can do with respect to diet. The next thing is the most important for our day-to-day practice is the exercise. So we have to do at least 150 minutes in a week. Either you can take at least 30 minutes in every day. You can take 2 days, half. You can take with a flexible time, either in the morning, in the night. You can do some muscle resistance exercise, and sometimes aerobic exercise like swimming, cycling. Okay, so this walking, this we can do. The next thing what we can do is take care of your diabetes part, the treatment what you prescribed by the doctor. That means without changing the prescription, you should take regularly, and you should always actually support it by your regular physical activity as well as and healthy diet. And you should not miss any medications. And whenever taking the medication, you should take it that some medications can cause always there is a risk of hypoglycemia when you have a less food or actually than the regular one. And if you miss the meal, that you have to take. Next important thing what we can do is actually the cope up your stress. What you meant to say, in nowadays we are doing a lot of where people are facing a lot of stress, especially in the COVID pandemic, and taking importance of taking care of your diabetes is the most important thing to do in this period. And people who are having diabetes and other comorbidities are facing a lot of stress. And please take care of your stress thing. That means you just minimize your stress by involving in the mind activities or even the yoga, deep meditation, deep breathing, and regular exercise. Engage yourself in other activities to bring down your stress level. The other thing, of course, quit smoking and as well as the alcohol intake. So if you stop alcohol and smoking, it definitely help your body to cope up with the heart attack as well as even diabetes and heart disease, even the blood pressure as well. In a simple way, what I conclude is, of course, diabetes is a serious problem if you don't take care of it, and it can cause the heart problem, and including it can affect your kidneys, it can affect your heart, brain, even eyes, even the food. In such conditions, what we need to do Just take care of your diabetes, it will take care of the rest of it. So do the things in the right way, the right. So this is what I'm going to say. So with this, I would like to conclude my talk. Thank you.